If your body mass index, also known as your BMI, is 30 or above, you are considered to be obese, or if you are 20% or more above your ideal body weight. In America today, 70% of adults are either obese or overweight, and 1 in 3 kids between the ages of 2 to 19 are obese or overweight. There are many reasons to keep your body at a healthy weight, but we are going to focus on the benefit of keeping your risk of heart disease down. Even losing small amounts of weight, such as 5 to 10% in body fat, can drastically drop your risk of heart disease and other heart-related problems. Obesity can cause many issues when it comes to the cardiovascular system. Obesity is often linked to both high blood pressure and high cholesterol, both of which are major risk factors in heart attacks and strokes.
Obesity causes abnormal blood fat levels, which in turn leads to a lot of other heart-related issues. Obesity often leads to low HDL cholesterol levels, which are your good cholesterols, and clean up the LDL, the bad cholesterol, from sticking in your artery walls. LDL is the plaque that can build up and lead to many issues within your cardiovascular system. HDL cleans the LDL, so when the HDL is low, it causes the LDL to be high with nothing to clean the walls of your arteries. These two things will come into play later in the discussion. Obesity also leads to high blood pressure. One specific heart disease it can lead to is coronary heart disease, CHD. CHD is the buildup of plaque in your coronary arteries, which are the arteries that supply your heart muscles with blood and oxygen. When plaque builds up, caused by low HDL and high LDL, it narrows or even blocks these arteries, and without blood and oxygen reaching the blocked off areas, parts of your heart can die. This can cause angina, which is severe pain in the chest that can spread to arms, shoulders, and the neck, and is caused by lack of blood to the heart. It can also cause heart attacks and lead to heart failure. As your BMI rises, so does your risk for coronary heart disease.
Another thing obesity can lead to is a stroke, which we focused on in our video. Strokes are also a buildup of plaque in your arteries, which then ruptures to form a blood clot. If these blood clots happen in your arteries supplying oxygen and blood to your brain, you have a stroke. As you saw in our video, you can diagnose strokes easily by using the acronym FAST. F stands for face. You should ask them to smile, and if one side of the mouth droops or does not come up, or if any other part of the face seems to droop, they could be having a stroke. A stands for arms. Ask them to raise both arms. Usually if someone is having a stroke, they are not able to raise both arms. S stands for sentence. Ask them to repeat a simple sentence, and if they are unable to form the words or if they slur, this is often indicative of a stroke. T stands for time. You need to get them to a doctor as soon as you can. Your risk of stroke increases as your BMI does as well. Another thing that obesity can lead to is metabolic syndrome. Metabolic syndrome is just a group of risk factors that place you more at risk for heart disease, strokes, and other problems like diabetes. Diagnoses are usually made if you have 3 or more of the following conditions: a large waistline or abdominal obesity, high triglyceride levels, low HDL levels, high blood pressure, or high fasting blood sugar. Fasting blood sugar is just a test that is taken before breakfast with no previous food eaten 12 hours prior to the test. It is commonly used to assess the risks for and/or control diabetes.
There are many negatives of being obese, and the risks of cardiovascular disease is one of the biggest ones. Eating healthy, exercising, and staying active can all help to cut down on your body fat and help you stay healthy and live longer. Fun facts. Each year, 2.8 million people die from a complication of being obese or overweight. Those with an apple shape or weight centered in their abdomen are at more risk for heart disease than those with a pear shape with weight centered in their hips. For the best health, adults' BMI should be between 21 and 23. 1 in every 4 deaths each year are heart disease related. Over half the heart disease deaths are from men. Coronary heart disease is the most common heart disease.